Hey, Adni fam, it is Anthony. I am so excited to be joined by Candace Clow today, who is the founder and CEO of Marvel Medical Staffing. And when creating this podcast and thinking about rehumanizing healthcare staffing, there's literally no better guest than Candace because she's creating literally like an incredible travel nursing agency that is all about rehumanizing healthcare staffing. So, Candace, thank you so much for doing this podcast, and I'm so excited to like dive into your story.
Thank you so much for inviting me as a guest. I'm very excited to share my story further and what we're doing in this healthcare space, especially going into 2024.
It is crazy that we are already going into 2024. I feel like the kind of post-pandemic era has been so fascinating for healthcare staffing, and I feel like 2024 is going to be really an imperative year, I think, for kind of the future of healthcare staffing and some of the trends that are going on. But before we get into all of that, would love to know like who you are, a little bit about you, a little bit about your background, and then, kind of how that background led you to founding Marvel.
Awesome. Yeah, I'd love to share. So I am a Nebraska native. I grew up, I've been in Nebraska all my life, which is funny. But I grew up in a small town. Actually, funny story, not a lot of people know. I grew up on a quarter horse ranch. So
Oh
we
wow.
raised horses. And I mean, small town, like my graduating class was 21 people, so tiny.
Wow.
And then I came into Omaha once I went to college. So I got a scholarship to play volleyball at Bellevue University, which led me to Omaha, Nebraska. And that's kind of why I'm set here today. So, been Nebraska native all of my life and love it in Nebraska. It is not a bunch of just a bunch of corn. So,
No, I've never been to Nebraska, but I definitely will have to come check it out, and I will let you know if I need some tips.
yeah.
I'm sure there's a lot of great food and everything like that. But
There is the expanding. I mean, people that come and visit now, especially from bigger metro like areas or cities, they're shocked by seeing the expansion that's going on in Omaha. So
yeah, yeah.
really big boom of growth. It's been continuing to grow. So it's actually the city is a beautiful area to live and raise a family. Again, I have actually I didn't share that. I have two little ones now. So we were just talking about this. Charlie, she's turning 5 tomorrow, and then Thomas, he is 10. So
No,
chasing our
that's
little kids at the same time.
I love it. That's amazing. So, what was this kind of founding story of Marvel? Like, I believe you were in like healthcare staffing before starting Marvel. How did you even like end up in healthcare?
So that's a great question. So when I graduated, my emphasis was actually in HR. So
Okay.
I started my career in college at a company called Cintas. Was there 5 years, and then I had did both HR and kind of had a sales background. Fast forward from my younger years, so just to kind of give preface of my care for healthcare, there's two really big pertinent pieces to that. One was I lost my father when I was 12 to a brain tumor.
Oh
We had a home
wow.
health nurse. I mean, that nurse was pertinent to our family during that time, so it was kind of ingrained in me.
Mm.
And then my brother is also juvenile diabetic. He's had constant issues. So healthcare has always been like a big piece of my family, just seeing some of the things that we've struggled with or went through and the care that we've received from a lot of those clinicians.
Wow.
But when I got into, so I had a friend that was in medical staffing, and I was like, what is medical staffing? I hadn't heard anything about it. And they were explaining it to me, and I still was extremely confused because this was all in the travel space. And
Yeah.
fast forward, Omaha is like a big hub for a lot of medical staffing agencies.
Yeah.
I had at that point in my career, I had wanted to go back into human resources. I love recruiting. I love the compliance piece of it. There's a lot of passion behind HR. But I was intrigued by medical staffing and looking at my background in HR. It's like, well, recruitment was a huge piece of that.
Yeah.
And so I thought I would give this a shot. So I got into the space and I worked predominantly with rehab therapists, and
Okay.
I fell in love with these clinicians.
Aw.
Just learning, it was different for me, finding connections with people, right? Especially if you're recruiting them, you're sending them across the nation, right, to different places. And I worked with a lot of new graduates. I loved getting to know their specialty. We knew all about their documentation, their education, their struggles. Towards the end, it was, I'd have some of my clinicians asking, are you, a physical therapist yourself? I'm like, nope, I work with all these clinicians and I'm very intrigued and I want to know all the ins and outs as much as I can to help them be the best recruiter possible. So
Right.
I did really, really well there. And then I had a company called Ventura MedStaff that was started by original founder of where I was and invested in, there are like 10 of us going in and
Wow.
starting another company. So I actually took that and left, I took that offer. And during that time, I think I was 8, 9 months pregnant with Charlie.
Wow.
So I was
Oh,
like, here I am taking this first venture,
wow.
9 months pregnant. I don't know what I'm doing.
Yeah.
And so that was really like jet setted me, as an entrepreneur, like into this space and doing it kind of more on my own. And then Marvel, so we had about a year in that space and it was wonderful. It was great, taught me so much.
Yeah.
But I realized as an entrepreneur, it's very, very hard when there's 10 different people, there's 10 different visions, things are
Yeah.
moving. And my vision was just different, and I wanted to rehumanize. I was very passionate about how we build and develop our internal staff as well as our clinicians. What are we
Mm.
doing to, be different for them, provide transparency? I had just seen a lot of ways that I felt this space could be better.
Yeah.
And so I was really ignited by, we're going to do this. We're going to start it in the basement of our home. And you have to have kind of a little bit of craziness and passion, right? To just think
Oh my
as
gosh.
just jump right in and pursue
Totally.
something. And then in November of 2019, we launched Marvel from the basement. So we put, I mean, all of my, all their ducks there into Marvel. We started in the basement of our home in rehab therapy. This was pre-pandemic, so I think everyone knows what happened with rehab therapy. Going into the pandemic, they were considered non-essential. So
Right.
first year of Marvel was really just, a lot of ebbs and flows. Like, we didn't predict anything with COVID at that point would happen, and then trying to do it in the space of our home with new employees. So yeah, it was a lot of moving parts that first year.
No, for sure. And I think the actual vision and mission of Marvel is so exciting and I think so needed really now more than ever because especially, during the pandemic, I feel like healthcare staffing, it just kind of like blew up because there was such demand. And I feel like sometimes within that process, there was just such kind of chaos that I think a lot of the times the clinicians were maybe under supported or didn't really get that one-to-one connection because it was just like there was just so much going around and there was just so many high paying contracts and it was just very focused on that. So I'm curious to just learn a little bit more about Marvel's mission and your vision for the company and how you kind of see that evolving and really becoming essential even more now in this kind of post-pandemic era.
Well, I think it's extremely essential. I think, everything that was going on with clinicians pre-pandemic, it was already there, right? They
Yeah,
were they were feeling that pain, feeling that struggle, feeling that stress of, being undervalued. And then we've got the facilities feeling pressures as well above their controls, right? Of we have to make profit, right? We have to
yeah,
be a center, right? There's so many intricacies of healthcare that I think needs to get better in time, and it's not something that, Marvel's going to change overnight, right? This is going to take a lot of teamwork and effort, but those pains significantly ignited through COVID. You saw the clinician side of it. You saw then on the facility sides working with agencies where these bill rates got, increased to astronomical levels, ones that weren't sustainable to where now you're seeing critical access healthcare or healthcare centers closing down. I mean, it's
yeah,
constantly this battle. And, in the agency side, right, we have to, my position has been complete transparency, taking, right, ownership for how, every single hospital system is going to need a contingent workforce program, right? There's
Yeah.
ebbs, flows, like, but we need to be a better partner. And that means we need to be a partner for our clinicians, right? With how we stand up for them. They're not just a traveler to us. How are they connected to us as Marvel? And that's what you guys do with your platform, which is extremely exciting, is how do we provide benefits, opportunities? How do they feel more intertwined with Marvel as a true, employee of Marvel versus you're
Right.
just from one contract to the other contract, and how are we supporting them? Last year, and we didn't get to move this further just because of, Marvel being kind of a startup and trying to really get our bare bones straight with what our initiatives are. But we did have initiatives where we were providing professional counseling, right? Or
Mm.
performance counseling for our clinicians. And I'm just such a huge advocate for that because I think everybody needs that, and we need
Yes.
to talk about it much more. I mean, being a female in the position that I'm in, trying to manage my kids and the stress that you get under, everybody
Yeah.
should have those types of resources given to them. So you have the healthiest mindset employees that feel that they have support. And then on the hospital side, what they're feeling is just that pinch of there's always been things that have been broken, right? How do we provide benefits, for our clinicians too that are here permanently? And my sister, I mean, she's been a nurse now for nearly almost, 15, 20 years working at a
Oh, wow.
hospital. And it's interesting to see, as a permanent, some of the things that, they try to give to their internal employees, but it's like not enough. It
Yeah.
is not nearly enough. So we're facing all these different battles. And then on the agency side, when I think of rehumanizing, I think of complete transparency. How do we connect everyone to be better together? Because really, at the end of the day, when you think of healthcare and what we do, I mean, it's all about patient care. And when you
Yeah.
talk to clinicians, they're getting pulled in so many directions. And at the end of the day, like all my clinicians, the reason they went to become a clinician was because of patients and
Right.
providing care. And so I think rehumanizing to me means how do we create alignments between the permanent staff, the travel staff, the agencies, the facilities? And guess what? A lot of it comes down to how are our bill rates, right, made up of? What are our consistencies? How do we build compensation plans that are healthy for all so we don't create these, I like to say create that monster, right? Where we're going, people don't understand. And I think digital transformation, I think technology is a huge play for that. Again, like how do we put the clinicians first? How do they have everything in one resource to make it easy for them? We have some really awesome initiatives we're coming out with our new technology where our clinicians can house everything in one space and they have ownership of their compliance documents. I think as healthcare professionals, you can see the cost that comes down to keep all those compliance items. Where do we store them? How are they housed? Right? How do we know when they're expiring, especially if you're working with multiple agencies or, permanent facilities? So we're excited about the launch of that in 2024. And then we're excited about providing a marketplace for our facilities, also be able to see their talent. So we're not just
Mm.
in control. So we're giving control more to the healthcare facilities themselves to manage talent, and then the clinicians on the same side to be able to pick and choose like where they want to go in their experience. So we've got a lot of work to do, but I think that all comes down to, part of our rehumanizing campaign and what we're doing in this space to be better.
I love all of that. So well said and so exciting. So many exciting things to come in 2024. And I think you're right. Like, I think technology can play such a important role in kind of the unity of, all of these different stakeholders and everyone's, aligning the stakeholders and what kind of everyone wants at the end of the day to kind of align those and streamline them. And I'm curious, kind of on that note of technology and implementation, I think one thing we're starting to see a lot more in like the healthcare staffing market and just in general is the use of AI, automation, a lot of these tools that, perhaps improve productivity and optimize, kind of a whole bunch of things. But I think there still is such a necessity for like that human factor, right? And the fact that like as your previous role as a recruiter and now, running Marvel, like the relationship and the rapport you're able to build with your clinician, I think from both perspectives is so important. Because I know for me as a clinician, like I want someone that I can rely on and trust and ask questions to and almost serve as a friend while I'm on contract. And then from the recruiter side, it's you're kind of also building these relationships, and that is obviously beneficial for your agency. So I'm curious kind of how you see the human factor still being super pivotal within this kind of innovative kind of environment I think we're really in now, with a lot of different technologies being implemented.
That's a really great question, right? Because everything is changing significantly, especially with AI.
Yeah,
And so I've always made a stance, and I'll still, I still believe in that, is that technology transformation, right, is going to be there to provide ease, right, for what we have access to, or maybe even that transparency or deployment for sooner deployment. But at the end of the day, if you think about it, a lot of us are comparing it to like Uber or Amazon, like type of experience, which is great. But if you think about it, those are products, right? Those are just products. We are dealing with people, right? People going into systems. This is their job. So yes, there's efficiencies, but if you think about it, if I'm a recruiter working with a facility and I have a clinician out in the space and I don't have some type of human element or touch to just ask, maybe pick up the phone and ask, are you okay?
right.
How are you doing? Like technology can provide that, but it's so insensitive, right? And people have feelings, we have emotions, we have thoughts, like we have all these different array of things that keep hitting at us, and in technology cannot assess a human emotion or a feeling. And so I think recruiters, we say the term recruiters, right? And we have some new terms that I think we're going to be moving towards in 2024, because it's so much more than just a recruiter, right?
Yeah,
Supervising, we're connecting, we're giving performance updates, right? And so I think that you have to create a model that provides both for efficiencies, and then creates measurements of success that are simple. And again, like I'm a big believer, if you can't measure it, then where does it exist, right? Like, and so it has to go twofold with what do we give them, what do we provide them with the knowledge that we receive through these platforms, these technology platforms, to help them be their best. So that's where I really think, the human element does not disappear. It makes us more efficient, but we're not going away. Like AI, you keep hearing like, is it going to replace the human element, right? Or are we nervous? Yes, I think we need to be proactive with how we use AI, but we need to be very careful. It will make us more efficient, but it's not going to take that human element away.
100% agree. Yeah, there's only so many like messages you can get to as a clinician, right? I feel like the automations is it's interesting how I think that can also just, yeah, as you said, it just feels
Yeah.
like insensitive. It's like it doesn't have that personalization or that, real kind of human to human emotional connection to it, which I think is so important. And so cool that Marvel is, still making sure that that human element is a part of everything y'all do. And I guess this kind of lends itself really well to the next question. And I'm curious to kind of hear from your perspective as someone who is literally like an expert in healthcare staffing. You've kind of, served in multiple roles from recruiter to now founder. For any clinicians that are listening that maybe have thought about, being a traveler, maybe thought or looked into contracts before, but maybe just, felt nervous or wasn't really sure it was right for them, and that, just was kind of scared to take that step into the process. Curious if you have any advice for clinicians who are listening who, maybe are thinking about travel nursing.
Well, I think that's great, right? There's, every leap that you take, like there's so many nerves that come around it. And I think when you're if you're thinking about diving into that, one which I'm now really standing for, like as far as just from a Marvel's perspective, is who do I want to work for, right? Like what type of vendors or partners do I want to have lined with me? What are their core values? What do they stand for? I think one, you really have to look at that. You can work with multiple agencies, but you're going to find out really quick what they stand for, what they represent. And I think one of Was it CBS was saying one of the biggest buzzwords for 2024 is authenticity. And
Yeah.
I could not agree more. We're really moving into making decisions that really drive our core values, right? So that's step number one. I think that is something you should always look at. Two is don't feel forced, right? Put a timeline in place, do education research, and then find an agency too that's going to be transparent with you. Um, Not every facility is perfect, right? Like you're painting like the wrong picture. I think
Yeah.
I think that when you're, especially with a new nurse, like you're going into a new space, a new location, right? It's nerve-wracking. You have housing you have to find. You've got to know like the truth or as much transparency you can around the contract that you're taking, right? Because, and again, the facilities that you're working with, they want to provide that knowledge to them too. We don't want to paint this beautiful, right, picture when maybe things aren't 100%. And then at least they know walking into that contract, the clinician does, they're set up for success because they know what to expect. So I
Right.
think the worst thing that you can do for a new traveler, right, is they're going in, a clinician's going in, they think it's going to be this amazing contract. They've been kind of sold, right, this whole image, and it's completely opposite. That never starts out a great relationship, and that's going to have a clinician so much more worried about traveling again in the future and who they can trust.
Yeah.
So I think that's what, if you think of a healthy relationship in general, doesn't matter. It all comes down to just being being okay with giving them the facts, the truth of the facts, and then us working together with, what am I willing to accept? What am I looking into? What am I scared of? What am I open to? And as long as you have that, you can go out, and then if you have, curves or twists or potholes, right, that you hit, you're at least aware of them to work together. So those are some really big tidbits that I like to give for advice when you're starting to look.
I think those are really great pieces of advice. And just to give some kudos to Marvel, I think one thing that really stands out to me about your website is how you are so kind of transparent and forward about your values. And I think even when you go to your website, like one of the first things I noticed is that next to your logo, you have women owned, which really stood out to me just because, I don't know, that's so special. And it just really, again, it kind of just brings that human factor back into the picture. It feels like right away, like, oh, wow, this is like a community, forward agency. And
Yeah.
then I love how you separate your values into like each letter of Marvel. So like M for mindset influences how we think, focusing on growth, positivity, accountable for our own and one another's actions. So yeah, you go through the values, and I
Yep.
just think that is so special.
Absolutely. Being, and that's for another, maybe another podcast to share, but being female owned is extremely important to me.
Yeah,
Some of the things I've had to go through, as a female working with some of the partners, discrimination is still there. It still exists. And there's a lot more change that has to be had. And when you look at the workforce of clinicians, like you see that change needs to even happen on the C level, right?
yeah,
Just in systems, right? And giving opportunity to clinicians. So I very much am a firm believer in, the female owned. You don't see a lot of agencies that are truly founded, owned, and ran by a female. I'm not going
yeah.
anywhere. I'm here for a long time. So it's exciting to be able to represent that. And then talk openly about some of the struggles that I've had, or that imposter syndrome of thinking, what am I really capable of doing? So that means a lot to me, and I'm excited going into 2024 just to share more of my personal story, and hoping that it impacts others to maybe pursue something that they were nervous about and have confidence in themselves. So
Thank you so much for sharing that. I know 100% the imposter syndrome, and just, being an entrepreneur, it's very vulnerable. But like literally kudos to you for building a full company, and like your team and the agency has scaled so much in like just a short time. And I think that's really a testament to you as an entrepreneur, but also to Marvel's mission and just like how important it is. So, with that, I know we are going to wrap up with our last question here. And I would love to know from you, especially with Marvel's mission being about rehumanizing healthcare staffing, why do you believe that rehumanizing healthcare staffing is more important now than ever?
Um, Now more than ever because we have left the past, right, kind of stay stagnant in where we were going. We didn't make changes um, that were prioritizing our clinicians, our hospital systems, and what we need to change, which is providing care to our patients and to our people. And now more than ever, especially when you see systems closing down, right? You see these shortages, which we've always talked about shortages. That's another discussion. Like, how are we educating our next future, right, to go into healthcare? Um,
Yeah,
but now more than ever, because when you're seeing, growing up in a small town, when you see a smaller hospital system close their doors, that means someone who could get to care within 30, 40 minutes, they're now having to go 2 hours. That could mean a loss, right?
yeah,
Or something significant. And so now more than ever, we really need to band together. And when you think of equity, right, and diversity, when we have more diversity within our healthcare, we come up with new ideas, right? We're more transformational. There are so many different pieces to this puzzle that we have to collectively work together to change for the future. Or I think, 5, 10 years, like that makes me nervous. What I think about every single day is what am I going to leave behind for my children? And the quality of care that they can receive, the health care that they're able to receive, right? That's their future. And I think in this space, if we can work together, we can create impacts, right? And do more for the future of our healthcare. And so right now, it's a pivotal time for us to make changes together.
I love that. Yes, unity. It's all about unity.
Yes.
And I think that is such an amazing way to end this podcast episode. So, Candace, thank you so much for sharing your story. It's so inspiring. And for everyone listening, go check out Marvel at marvelmedstaff.com and you will see right away all of the values, the jobs that they have available. You can see more about their team. I love how they have like adventure on their website as well. So, congratulations on everything you've built, and thank you so much for sharing your story with us.
Thank you, and congratulations to you too. I'm excited to work with your team more and your platform, so that's extremely exciting for us at Marvel. And then another note that I'll just drop: we have a new website release going into 2024,
Oh.
so even more exciting changes to come. But we're really excited to move into this next year with some new updates. So
I can't wait. 2024 is here already, basically. It's
I know.
wild. Time is flying by, but yes, lots of exciting things to come. So thank you all for listening and have a great day.
Thank you.